Welcome to the Explainer. Today we're diving into an injury that can happen in the most random ways, like catching a ball or even just tucking in a bedsheet, but it requires a ton of patience to fix. It's called mallet finger, and you'll see that the secret to healing is all about what you don't do. Have you ever been there? You're playing catch, maybe making the bed, and all of a sudden you look down and the tip of your finger is bent and it just won't straighten out. It's such a weird feeling, and it's actually way more common than you'd think. If that scenario sounds even a little bit familiar, then yep, you've likely met what's known as mallet finger. So let's break this all down. We're going to walk through what's happening, how to get it fixed, and what you can really expect as you get better. So first things first, what is actually going on here? Okay, so what is physically happening inside your finger to cause this? The easiest way to think about it is that the tendons in your finger are kind of like tiny little ropes. The one on top, the extensor tendon, is the rope that pulls your fingertip straight. With mallet finger, that rope has snapped. It either tears, or sometimes it even pulls a tiny chip of bone off with it. And really, it's a super simple chain reaction. There's a sudden, sharp force that bends your fingertip way too far. That's the impact. That force is just too much for the tendon, and snap. The result? The whole mechanism that pulls the tip of your finger straight is broken, leaving it to just droop down. So you've got a drooping finger. The next step is getting a proper diagnosis so you know exactly what you're dealing with. Now, what's kind of cool here is the difference between what you experience and what a doctor actually confirms. You're going to feel the pain, the tenderness, you'll see the swelling. A doctor confirms it by seeing that classic droop and the fact that you physically can't straighten that joint on your own. Now, a doctor can often tell it's mallet finger just by looking at it, but the x-ray, well, the x-ray is the real detective here. It tells you the most crucial detail. Did the tendon just tear, or did it pull a piece of bone off with it? And believe it or not, that one piece of info can completely change the treatment plan. Okay, pay close attention to this. Most mallet fingers are not a huge emergency, but if you see any of these signs, especially an open cut, a bunch of blood under your nail, or any numbness, you need to get it checked out immediately to avoid infection or other serious problems. All right, now for the most important part, healing. And for almost all of these cases, the treatment isn't some complicated surgery. Nope. It all comes down to one simple device and a whole lot of discipline. That's right. The solution is just to lock that fingertip in a perfectly straight position. By doing back, you're letting the two torn ends of the tendon rest right up against each other so they can heal back together all on their own. And here it is. This is the single most important number in this entire explainer, 6 to 8 weeks. And that's not just some of the time. We're talking nonstop, 24 hours a day, 7 days a week. Your commitment here is literally everything. So listen, this is the crucial point. If at any time during those 6 to 8 weeks you bend that fingertip, even for a split second, you can re-tear all the delicate tissue that's just started to heal. And guess what? The clock resets to day one. You absolutely positively cannot let it bend. But what happens if the injury is more severe? Or if the splint alone just isn't cutting it? Well, that's when we have to start thinking about a more direct approach. Surgery is usually saved for the really tricky cases. You know, if that bone fragment is big and has moved out of place, or if the whole joint is unstable and wobbly, a surgeon might need to put some pins in to hold it all together. It's also the last resort if months of perfect splinting just haven't done the trick. So after those 6 to 8 weeks of being super careful with the splint, what happens next? What can you expect for the long run? This is the question on everyone's mind, right? After all that effort, is my finger going to be back to normal? Okay, this is where we need to set some realistic expectations. Even with perfect treatment, a lot of people are left with a very slight droop at the fingertip. We're talking less than 10 degrees here. So it might not be perfectly arrow straight. But here is the key takeaway. That little cosmetic droop almost never affects what you can actually do with your hand. You'll get your strength back, your grip back, you'll be able to do all your normal stuff without any issues. At the end of the day, the outcome for mallet finger is overwhelmingly positive. So if this happens to you, the message is simple. Be patient, be incredibly diligent with that splint, and trust that this is a well-worn path. Your finger will get back to work.